Hi, everyone. This is Alana with NOCC, and we will be starting in just a minute. If you could just be patient. We just want to make sure that everyone is ready and on the call at the right time.
Looks like we're going. I'm getting that message as well.
Okay. Well, it's 3 o'clock. I think we're ready to start. So I am Alana Feuchter, and I am the Senior Manager for Patient Advocacy for the NOCC. We had planned on starting and Ask the Experts using this kind of platform, but we had not planned on starting until April, and then COVID hit. And we decided we had to act faster and reached out to Dr. Nita Lee, a gynonc at University of Chicago, and she was kind enough to offer her time and her expertise in managing cancer care during the pandemic. So welcome, Dr. Lee.
Thank you very much for putting this together.
Thank you. So I will ask some questions and Dr. Lee will respond. After the questions I have asked, we will allow time for individuals to type in their questions. Please keep in mind that we are not answering individual questions at this time, but more generalized questions. But I'll repeat that afterwards. So I think we'll just get started with our questions right now.
Good.
The first is, with somebody who has cancer, what kind of special precautions should they be taking?
Well, I think right now in the setting of coronavirus and the COVID-19 pandemic, we really all need to be taking the same precautions in a way. We really have to be practicing good hand hygiene. So washing your hands frequently, 20 seconds, soap and water, warm water, using alcohol-based hand gel or sanitizer if you're not able to wash your hands, and practicing social distancing. So really, not being in crowded spaces. If you have to be somewhere, grocery store, even at the doctor's or in a medical center 6 feet away. A lot of places are actually putting down tape so you can't stand too close to people, and being very mindful of not touching your hands and face and nose and mouth when you're in public, quite honestly, so that you can go home, wash your hands, and keep safe. I don't know if that's any different than what our cancer patients or patients who've had an experience with cancer should do, but I think we really all should be doing the same thing, quite honestly.
That's great advice. What about the question that I'm sure a lot of our cancer survivors are concerned with, given that they might have a compromised immune system, are they at higher risk?
This is a very good question. We're really learning a lot from our colleagues internationally, from many countries who are sort of facing a sooner onset of this disease in their communities and in their hospitals. We are concerned that patients who are immunocompromised because of an active treatment regimen, or perhaps newly treated, could be more immunocompromised. There are reports of patients who get the virus and get COVID-19 having a more serious disease effect or getting sicker, but there's some mixed reports of like, is everyone more at risk? Somebody who's had a cancer history and is not on active treatment and does not have issues with their counts may not be necessarily more at risk than someone else. Also, other medical problems also kind of make risk factors, such as older age, lung disease, heart disease, diabetes. Those are all other factors as well to take into account.
If someone is to begin showing symptoms, let's say they get a fever or they have a cough, at what point should they consider getting tested?
That's also very good questions that you've come up with here in terms of, I think the best thing to do is to really make sure you're in close contact with your physician team. For many ovarian cancer and GYN cancer survivors, that is our GYN oncologist, right? So we get a lot of questions, or sometimes somebody's close to their primary care doctor or something like that. Really make sure you talk to them and tell them what your symptoms are so they can best direct you as to what's happening in your medical community or hospital. So fever, cough, body aches, generally flu-like illness, those kinds of things, definitely call first. Do not go to just showing up in the emergency room or an urgent care is just not the right thing to do. If you call, then you can know what the best and safest way is to get testing if it's appropriate.
Okay. This is going to be, I'm sure, a very a question that's very high on everyone's list, and that is, should I be delaying my chemo, my surgery, my radiation?
Right. This is a really tough question. And I think we've been all really struggling with all of this because things have changed so quickly. This is something which, again, really rely on your doctors and your GYN oncology team or your oncology team to be able to help guide this discussion, because we're also getting a lot of really great data from our colleagues around the country and across the world about what is safe, what we should and shouldn't do. Things also change from hospital to hospital and community to community as the coronavirus prevalence and incidence in the different hospital settings or in different communities change. And so that can really change the dynamic of, is it actually safer for me to get another cycle or 2 cycles before I have my surgery? Or actually, we can continue your chemotherapy right now, but these are the precautions that we're taking. So there's a lot of nuances. And I think I think we just want to really express that from our, from a GYN oncology perspective, our Society for GYN Oncology, all of us are really taking each of our patients' conditions and circumstances so to heart when we're making these decisions that, but we've had to do it in a changing atmosphere with changing data. So we really think it's a personal thing, and we're going to be there as part of the team to help get people through it.
How about people who maybe are not in treatment or are in treatment and are wondering about doctor's appointments, port flushes, blood work? What about those?
I think those are all really good questions. I think we're really trying to limit the amount of time people are leaving their home, exposing themselves in a different circumstance, even though our hospitals and clinics are doing all sorts of precautions to screen patients before they're coming. So a lot of people are really moving towards telemedicine visits, telephone encounter visits to check in to make sure that you're doing well. If you're not having symptoms and you're feeling in your normal state of health, I think many places are actually delaying the visit that you're coming in for a pelvic exam or a visit that you're coming in for a CA-125. And I think there's data to support that if you're feeling well and there's nothing new or different in terms of pain, GI or GU, like bladder symptoms or anything else like that, this is a safe thing to do. And that's where the risk benefit ratio really falls on. It's, we don't want to put you at risk if we don't need to.
If your doctor does recommend that you should come in for one of these types of procedures, should you wear a face mask?
Very good
If you
question.
can get your hands on one.
Yes, yeah. I think that, face masks are a controversial topic in some ways right now, because we do have shortages in the medical center for providers, and we're trying to limit some of those things. I think that in patients who may be immunocompromised because of their counts or on active chemotherapy, there are times that we're doing that. In patients, there are times definitely anybody who's coming and getting screened for any types of symptoms are actually being really triaged very carefully and asked to wear a mask immediately. I think it kind of depends a little bit on how you're going to get yourself to your appointment as well. And just know that really a mask could be important, but also really making sure hand washing, staying distant, and then also not touching your hands and face. Because if you're going to wear a mask and that makes you touch more things and then touch your face, then that may not help you in the end. So
You kind of hinted on another question that I had, and that was, if someone is coming in, is it okay to use the valet parking or to take a ride share to get there?
I think it depends on what your comfort level is. I think, there are times where we have many patients who use those things. And if we need to, I think we're doing all of the different places are probably doing their very best to keep this as safe as possible. I would definitely consider, if you're going to be going in a car in a closed space, consider wearing a mask if you can, or making sure you have hand gel with you if at all possible. And thinking about if there's anybody else that's within your family unit that you see normally, that they could help you with that as well. But that may not be the case. So I think we have to use our best effort to stay safe, which again is really good hand hygiene and distancing when you can.
How will I know if I'm okay, if I'm a patient and I'm not getting surveillance?
I would really trust your instinct about how you're feeling. Any, exam, not exam, but any physical feelings or findings. I mean, it's hard because I think, I always think we already, can drive some of our patients crazy by saying like, oh, just let us know if something happens or feels different. And now in this like heightened sense, people can feel that way, but really kind of, put yourself into a calm place and really think, am I really feeling any different than I was last month? And if you're not, in terms of new symptoms that were really concerning you, I think you're going to be fine. It just means that, again, have that conversation with your doctor. Sometimes it's some of our physician extenders or nurse practitioners or nurses are helping triage some of the calls as well. So someone on your team will likely reach out if you're going to be having a delay in any of your appointments. And that's a good time to talk to them about how you're feeling.
Another question that we have is, what about clinical trials? If you're in a clinical trial and the trial says that you have to get a certain procedure done every so often, will they continue? And then what if, in the instance that the clinical trial isn't in your neighborhood and you have to travel to it? Should you be participating?
Yeah, I mean, we are, I think even the clinical trials, we're trying to keep a lot of our patients in our scenario on trial when we can, but we do have to make adjustments because we don't want to have any unnecessary trips. So a lot of trials are being, I wouldn't say like edited, but they're sort of like really looking at each step of like any contact that the patient would have to have and really analyzing, is that really necessary? Can we omit that right now? So each trial is really looking at that very, very carefully. I think travel is really something to be very cautious about, depending on where you're traveling, how you would travel. We know that we were concerned about airfare, like flying and those kinds of things. So I would really balance that again with both your local team and if you have a team that's in your distant location, because we really don't want to increase your risk of something that can happen more acutely and more suddenly for something that may be beneficial to delay even by a few weeks. We don't want to send anybody into the height of something where we think that a very careful delay, which can sometimes happen with chemotherapy and trials on a normal basis, and we know that that's safe and those safeguards are in place. So I think for trial patients, we're really trying to, again, each institution is looking at what's safe for their patients.
How about prescriptions? What if I'm concerned about trying to get my prescriptions?
Yeah, I mean, I guess I keep centering this around like just make sure you have a good method of communication. Sometimes people are using like electronic my chart. I know we've really revved up responding to those kinds of things. Sometimes, we know that doctors are responding via telemedicine and telephone encounters. Pharmacists are very, a lot of pharmacies are doing deliveries when they can so that you don't have to go out. All of those things are really important, especially in terms of in patients who may need pain medications, nausea medications. Really look at your supply and say, hey, what is it that I'm going to need before it's like you're taking your last pill, so that we have a few days to kind of get you what you need without feeling stressed about it.
And then my last question, is it okay to take a walk outside? And what about ideas for exercise and relaxation?
Yes, I think it's still okay to go outside. Obviously, it depends on where you live as well. There are sometimes some restrictions on public parks or things like that in places and cities that have kind of been are more closing in because of different circumstances, but still walking in your neighborhood, keeping social distance. So this is not a time to have, a cocktail hour with your neighbors because everyone's outside. But I think if you go for a walk and you can, maintain 6 feet of distance from your immediate family. So you may have a core group. So we went for a walk with my in-laws, but we were literally 8 feet away from them because when we let the kids wave to their grandparents, but we kept distance, but we were all outside enjoying a nice day. So just being really aware of maintaining social distance, whether you're biking or walking, would be really important. But I think it's always very good to be outside. I think it's really important. It's a great way to kind of address, all of our anxiety and all of our concerns.
That was what I was just going to say. And you addressed other ideas for relaxation and exercise. I'd like to open it now for questions, and I see that we have several. So let me ask.
Yeah.
Someone asked, what about those who have been NED for 9 years and fighting viruses like shingles on a regular basis? Is there anything that they should be wary of?
I think it's that I think you would probably be, you'd probably be in the same category of many people who may not have had a cancer diagnosis, but may have found themselves like a little more prone to something, whether that was due to their cancer history or their age or something else. So really, again, really the same rules apply in terms of the social distancing, the really good hand hygiene, limiting your exposure to other people, and then also it's okay to also limit your exposure by asking other people, like, oh, like, if you're really going to be seeing someone, really knowing who they're going to be seeing too. So, but I think quite honestly, in this day and age, I think the less is more. Online texting, video chatting, those are going to be our way of being interacting socially for right now.
Another question that we had is, will trials be accepting new patients at this time?
That also, I think, really depends on institution dependent decisions. So some of those decisions are made based on the type of trial it is and what kind of drugs that they're using, those kinds of things. Some of it may just depend on that institution and where they are in terms of how they're trying to space their chemotherapies and prioritize not exposing new patients. So again, most places who do clinical trials will have a online presence or a phone number that you can call, or through your oncologist, find out what is the story right now. And in some cases, a clinical trial may not be a good option right now, but could be in a few months, or vice versa. So I think it's again, it's so unique to the place.
Okay, this example is, my daughter works at Target, so should I not be seeing her in person, or is it okay to keep the distance? And this would be for anybody who has a family member who is working in a grocery store or.
Yeah, I mean, I think that you have to see, is it feasible for you to do that? There are times where you're living with somebody who is in the same home, and you have to, try to maintain things like, for example, all of us as health workers, we're still going in and we have to maintain some semblance of that. There are just different extremes of that. I think if there's a way to be safely within your household and practicing social distance by not sharing a bathroom perhaps, or not sharing, making sure you're very cognizant again about the hand hygiene. But there are times where we're also saying that maybe it is a time to not necessarily see your loved ones. Now, this can vary from town to town, state to state. And so I don't want to make too many blanket statements, but I think it's something to think about, because I think in cities and states and communities that COVID maybe has not really affected yet, I do sense that there are things that may change in the future, and you'll just be ahead of the game in thinking that through.
Another question. Can you please comment on any risks associated with PD-1 or PD-L1 inhibitors or PARP inhibitors?
Right. Yeah. So, I mean, I think that the risks for specific, so the PD-L1 inhibitors or the immunotherapy medications, in terms of like, should we be delaying specifically immunotherapy because of any risks to the patients? Is that more than the chemotherapy risks? We're really trying to answer those questions right now. And we're really looking at like, what are the person's like individual other risks? So again, it's really case by case. There's some patients who we're keeping on therapy, some patients who've been on maintenance for many years. We're saying, okay, can we stretch this out and give you a break at this point in terms of things? So a lot of this is really important shared decision making, but it has to be done with like the best data that we do have, which is unfortunately, because of this issue, changing so quickly. So I think, again, really talk to your doctor. There's not one blanket statement yet that's coming out that says like everything in immunotherapy should be held. But I think we're very wary of how quickly that may change as we gather more data. And the same goes for PARP inhibitors. I think PARP inhibitors are some patients who are a little bit more sensitive to PARPs in terms of how their counts can be, especially their white blood cell count. So that could be something that your doctor may adjust your dose for, may ask you to space out, like in terms of like knowing based on your individual history. So I don't think there's like a blanket statement that everybody should stop everything, but at the same time, really trying to tailor it even more.
This question you did address, but I'm just going to have you answer it again. How do we best protect ourselves during active treatment at our medical office treatment center?
So I think, again, like really making sure that you understand what kind of the rules of the medical center are going to be. We're actually doing, a lot of places are doing things like not having visitors, not having, extra people spacing out chemo time so people aren't kind of in busy labs or anything else like that. So I think, the question would be whether or not it's appropriate to wear a mask. That could be something to ask your individual medical provider as well as the center. Again, pre-calling to kind of ask that question, making sure you have hand sanitizer with you, those kinds of things. Those are going to be the best things, quite honestly, and keeping a good log of like what your symptoms are so you can report them.
Well, I think we've been incredibly thorough because I don't know that we have a whole lot of other questions. So I'm going to give it another minute and just allow for
Sure.
anybody else who wants to ask a question to ask. So if you have one, please type right now.
Yeah.
While we're waiting for those, I do want to say that, as I said in the beginning, NOCC is going to be continuing these kinds of question and answers with medical professionals. And our next one will be April 30th, and it's going to be addressing cancer basics with Dr. Sarah Taylor of the University of Pittsburgh. And then on May 28th, we will be talking about tumor testing with Sonia Alexander of Foundation Medicine. So we are trying to keep them on the last Thursday of each month at 4 p.m. I think we might be getting another question or two while I'm waiting.
I think one thing that we had kind of, as we were planning this, we were talking about is that this is really a time of uncertainty for all of us. And I think, we talked a little bit about this when in some of our other conversations, that this is really a time for patients who are ovarian cancer or GYN cancer or any cancer patients to really understand that the uncertainty that has, a cancer diagnosis brings to your life and to your family's life has also brought you a significant amount of resilience and coping mechanisms, and that this is what you're going to draw on. And it may even be something that you want to share with your friends and family about how do you cope and what are the things, whether it's, like you said, like you mentioned, like exercise or, meditation or mindfulness, what are these different ways that we can all sort of, learn how to manage our own anxieties about the changing circumstances. I think it's not always, I think our patients offer us a lot to learn from too. So I think that's really important.
Thank you. A couple more questions came in. If you don't mind, I will ask you. Should a husband and wife still be sharing a bed if there are no symptoms? But she or he, I guess, if we were not talking GYN, but if she was in active treatment?
I don't think there are restrictions on that. I mean, I think that people who are sort of like more practicing, like more sort of quarantining themselves are sometimes health workers who are in like the frontline setting and taking care of COVID-19 patients. They're definitely patients and colleagues who've really actively decided that they're going to, live in a different part of the house, or some even living separately. If there are not patients, like if you're not having any symptoms and that person themselves is not in a high risk situation where they're, actively in a circumstance, I can't imagine that there's something that we should be doing. But again, think about what your individual circumstances are, talk to your doctor, and to really get through, would that make sense or not?
Another question was, what are simple things patients can do to keep their immune systems up?
There's not one great trick, but I do think that thinking about like, how do we manage stress, making sure that you're staying, like getting some physical activity in, making sure you're paying attention to your nutrition, not that there's like one diet or one thing to eat or not eat, but just making sure we're doing everything that we're supposed to, which is to kind of keep a balanced diet, keep things, trying to maintain a schedule, even when your work schedule or your life schedule may not be as normal as it is. So I think all of those things, and thinking about how do we all deal with sort of chronic stress and manage that may help our immune systems. But there isn't one, one fix in terms of any type of, I would definitely not necessarily think that this is a good time to try any new supplements or do anything that's, advertised. There's a lot of, compared to somebody who's in the midst of a cycle, for example. Now that all really varies because some people can have very different responses to their chemo and may have different baseline counts depending on like how much chemo they've had. So again, this is such a personalized issue. It's hard to kind of be too specific.
Yeah, there's several questions that are very specific. So I'm ignoring some of those.
Yeah, I think just, take your questions to your physicians. I think they do want to answer those. I think, if you have a chemo team or a chemo nurse or anybody who's been, part of that team may be able to answer that. I think we are aware of who our patients are on chemo and are reaching out to them to answer those questions. It may even be some questions that you can get answered when you're coming in for an infusion. So just to be wary of it. You don't need to, and sometimes the electronic charting is kind of a great way to reach out without feeling like you're bombarding your practitioners as well.
Okay. I think that might be all of the questions. Let me just take a quick peek. Nope, I think that's good. I would like to thank you, Dr. Lee, for the time you have given and the amazing information that you have shared with everyone who is following. And if for those who missed it, they can watch it later. And I just would like for those who are here, if you have some ideas that you would like to have us do future topics on, if you would just write those in the comment line as well. And then to everybody, to Dr. Lee and to everybody who's watching, thank you and please stay safe. And I hope to see you again soon.
Thank you very much for putting this together. Have a good day.
Thank you.
All right. Bye.